Hi, welcome everyone. I'm Davidikus Wong. It's nice for them to reschedule the English leaders debate so that you can all watch my Empowering Patients talk with Leona. I'd like to introduce Leona. So she's the behind the scenes mastermind behind the Empowering Patients program. I'm just the figurehead. I just
You're
do
the
all the research
face.
to put my
Pretty
slides
face.
together. But
Yes.
she's very active in the primary care network and the Burnaby Division of Family Practice. And she's got a lot of great news that is useful beyond this talk itself. So
Excellent.
over
Thank
you go,
you,
Leona.
Dr. Wong. Yeah, thank you so much. And thank you for joining us. We're heading into our Easter weekend. Hopefully you're going to have some family time, some fun time, some rest. I'm looking forward to a little bit of rest, which is going to be great. So some of the things that I like to share here is information about our Empowering Patients program. We have a website. This is the last talk in our series, actually. We book until April, and then Dr. Wong and I will work over the summer to put together our fall program if he's game to do this again. So send out his cheers to do this again. So we'll come up with our new schedule of talks. So in the chat, I'm going to put the link to that page, which will also include the recordings for all the talks that we've done over the past year. So if you missed any on healthy eating or anything like that, there's lots of great topics there, and you can watch the recordings of these talks. Dr. Wong also, he puts together our slide deck that he'll go through tonight for each of these talks. He edits them, updates them, and shares them, which is great. So you can actually click on a link in the other resources page for the other presentations, and basically a high-level information page for each topic. So you can print those, you can share them with friends and family if you think it'll be of value to them. If you live in Burnaby and are looking for a family doctor, or if you live anywhere in BC and you're looking for a family doctor, there's a page that I'll share as to how you would get added to the wait list. I'm going to put in Walk with Your Doc is coming up on May the 17th, and Dr. Wong will be there. I will be there. We'll be together in person. It's May 17th, so there's a registration link for if you'd like to come out and hang out with us on a Saturday morning. There'll be some free swag while supplies last. I always have to say that. And yeah, so it's a time to get outside and be active together. You can bring your family, you can bring your dog. Sometimes Dr. Wong brings Teddy, his puppy. So that's an opportunity to get together. And we're also hosting a BC Family Doctor Day community event. That'll be on Thursday, May 15th. And that's an opportunity for us to celebrate our wonderful family doctors. So World Family Doctor Day is May 19th, again, around the world. And we in Burnaby like to celebrate our local doctors. So we're having a community event. We'll have food trucks there. We'll have all of our staff will be there, and a bunch of our doctors will be there just to hang out and celebrate and acknowledge what they do for us in the community. So May 15th, I'll put a link in the chat. You don't have to register. You can just show up. But I'll put all the information in the chat for you. What else are we going to talk about? We have our Burnaby PCN. So much work goes on in Burnaby in collaboration with the Burnaby Division, the Fraser Health Authority, and our community partners. So we have many services that are now available to Burnaby residents. So if you're unaware of any of those, please check out the link that I'm going to put in the chat. There's social services, there's community services, there's community health fridge, so many things that are available now to you. So be sure to check out that link. And then the last thing I'm going to put up in the chat, or one of the last things, is a evaluation on tonight's talk. So we always ask for your feedback as to what you liked, what you learned, how you heard about us. That just really helps us in our planning. So as we go into planning for next season, it'd be really helpful to have that information. So thank you for those that have participated before and have completed that survey. And something a little bit different this evening is we do have a provincial funding group called Shared Care Funding, and that's basically to support collaboration between family doctors and specialists. So I think all of us have had experiences with both, and so the Ministry of Health has really put some actual funding and resources together to make sure that they collaborate and work together, because sometimes it feels like that it's a bit fragmented, but it's kind of not. We actually work together with our specialists. So the shared care funding is happening. We have programs going on, projects that go on all the time just to increase that collaboration. And I just have a bit. So right now we have a project going on. I'm just going to hop up. Here we go. So it's preventative care and metabolic testing. So that's a project that's just now been approved. We've got funding for it. And what's going to come of this is some testing opportunities. So pop-up testing clinics that'll happen in Burnaby here. I can read this verbatim if you like, but preventative care is taking measures to prevent disease and maintaining overall health. So your blood pressure, etc. Metabolic testing plays a critical role in preventing care by providing insight into individuals' metabolic health. Metabolic health refers to ideal levels of blood sugar, triglycerides, HDL, cholesterol, blood pressure, and waist circumference without using medication. It relates directly to person's risk for heart disease, diabetes, and stroke, and is foundational for overall well-being as the process powers every cell in the body with energy generated from food and environment. So hopefully you're able to read that. And then the next slide is, hang on. So what the project is making the screening available for unattached patients. So if you have a family doctor, then this stuff will be covered for you. But if you don't, then this project is here for you to help to make some of this testing screening available to you. So this project, the initiative aims to create awareness about preventative care to empower you to live healthier lives and explore solutions to increase access to screening tests for unattached patients. So if you're unattached, that means you don't have a family doctor. So I'm going to put this information in the link for you of the upcoming clinics that are going to happen in Burnaby. And I will also put our shared care email address in the chat. So if you have any questions and you want more information on this shared care project or others, you'll be able to follow up beyond this talk. So that's it for me. I hope to maybe see all of you in person on May 15th at BC Family Doctor Day and on May 17th at Walk with Your Doc. So I am going to pass it over to Dr. Wong. And if you have any questions, please feel free to pop those into the chat and Dr. Wong will do his best to cover them at the end of the talk.
Great, thanks, Leona. So just to clarify, unattached means if you don't have a family doctor, but if you're married, you can still go if you don't have a family doctor. But actually, it's pretty aligned with the screening tests that we recommend. So if you want to know what screening tests you should do at different stages of your life, depending on your gender and other risk factors, look at my previous talks. We did recent talks and videos and handouts and posters, so you can quickly look up what tests you should be doing. And we've also talked about symptoms that you should be watching out for too. But if you don't have a family doctor, look at our past Empowering Patients talks. We're pretty up to date in going through things that you need to know to look after your health. So I'm just going to share my screen. And briefly, it's going to look really crazy, but these are just things I've been working on in the past day or so. So I'm going to switch over. Are you able to see my slides, Leona?
Yes, the slides are great.
Okay, ready to go.
Yeah.
So the topic today, what everyone should know about high blood pressure. And I'll be explaining what blood pressure is, who should check their blood pressure, and the fine points about why blood pressure is important and how we can make errors in measuring our pressure, and then what you can do to manage it, in addition to medications, if that's appropriate for you. So this is part of our productions with the Empowering Patients program, which is essentially over 10 years, we've been giving public talks to raise health literacy, to raise everyone's understanding of important things that we should know to look after our own health. And it includes the basics: healthy eating, understanding how to communicate with healthcare providers, what screening tests you should have, healthy physical activity, which is just the main drive behind our Walk with Our Doc next month. So look forward to seeing all of you in person. And I will be giving an empowering patients talk for half an hour before our big walk around Confederation Park on healthy physical activity and how to fit that into your activity. So more details are on our division site under empowering patients. And again, we're all here today because we're part of this big circle of caring, and family doctors care about our patients. We develop a longitudinal relationship with our patients, but it has breadth and depth as well, because we, unlike our specialist colleagues, we treat the whole patient in the context of what their values are and their social situations too. And what we've been doing through the Burnaby Division of Family Practice and our primary care networks is showing how we care about the whole community. And because if we look after one another, we're looking after our future as well. So as family docs, we care about our patients and we care about our community. So I always start off with just rethinking healthcare. So is healthcare all the activity in the hospital or in your family doctor's office or in the pharmacies? When you think about who's the most important person that provides virtually all of your healthcare, and it's not me, and it's not the nurses and dietitians and other professional healthcare providers, it's really you. And we're here to support you, to let you know and what you need to do to live a healthy life, how to communicate with healthcare providers to get your needs met. And we're here to connect you to the resources you need to live your best life and to achieve your greatest goals. And I'd like to think of healthcare as self-care to a large extent. So the best predictor of our future health are the habits we practice every day. And the 4 foundations of self-care are what you do, physical activity balanced with rest, what you eat, what you put into your body, our most recent talk, how you feel, emotional well-being, and how we connect, our social relationships. So these are big themes that continue to be a big topic of what we discuss in our patient education. So what you eat, what you do, how you feel, and how you relate. And I think of health not just in terms of illness, and health is not the absence of disease or conditions, because we always have conditions that we need to manage, but rather healthcare is more about achieving our positive potential in life. And it's our duty to realize our personal positive potentials and to help others achieve theirs. That's kind of my mission statement in my life and in my practice as well, to help every patient, every individual I meet in the office and outside to achieve their potential. And that doesn't mean being perfect, because we never are. We're just human, and there's always something that comes up. And it's really guided by your personal values. So what do we all need to achieve good self-care? We need knowledge that's not biased. We need professional and peer support. And we need planned care, like planning our health, especially if we have chronic conditions. So just want to explore 5 myths about blood pressure. Number 1, most of us think of it as a number. So I'll put those numbers into context so that you really understand what they mean. Another myth is I don't need to worry about it because I feel totally fine, because blood pressure can be high without any symptoms at all. It's only when it's extremely dangerously high that we might get some symptoms like terrible headaches or chest pain or shortness of breath. And some people think it's only high when they're at the doctor's office, which is common in some people with white coat syndrome. But if it's high in the doctor's office, it'll be high in other situations that are particularly stressful. And we all have those every day, every week. And people worry that if we start you on medication for blood pressure, you're stuck on it for life. Sometimes it's necessary, but there's a lot of things that we can do to reduce the amount of medication we take, reduce the number of medications. And I have a lot of patients that initially required medication, but through wonderful things they've been doing with their lifestyle, they're able to come off their medications as well. So first off, what is blood pressure? So basically, blood pressure is the pressure of blood inside our blood vessels, just like there's a certain pressure of water that's in your plumbing system at home so that the toilet flushes, so the taps run, so you get enough water into the kettle. Too much pressure is not good for the pipes and the whole system in your house. And too low a blood pressure, like water pressure, is not very functional to get the blood to every organ in your body. So it's important to have just the right range of pressure for your good health. So when you see a blood pressure reading, there's two numbers. There's the top number, which we refer to as the systolic pressure. And I'll explain what systolic means in a moment. And the lower number is the diastolic pressure. So for example, with these numbers, 108 over 72 means the systolic pressure, the higher number is 108, and the lower number is 72. Likewise with 120 over 80, systolic pressure is 120, diastolic is 80. So systolic and diastolic come from the word systole and diastole. Systole is when the heart contracts, and that's when the pressure rises. So that's the top number, the higher number that you read. And diastole is when the heart muscle relaxes again, and that's when blood pressure drops, but it doesn't usually drop to zero. There's usually a baseline pressure when the heart is relaxing between contractions. So that's the lower number. So there's another example. So systolic pressure is when the heart contracts, blood vessels are more constricted, and the pressure is higher, and the diastolic is when the blood vessels are relaxed with every heartbeat. So officially, the number for high blood pressure is 140 over 90. So systolic over 140 or diastolic over 90. And these are in millimeters of mercury, though you'll rarely see the mercury blood pressure machines in the office anymore. That's because of WorkSafe BC says that's dangerous to put in new ones like that because of risk of spilling mercury, although this doesn't usually happen in a doctor's office unless there's an earthquake. So totally normal blood pressure is around or below 120 over 80. Pre-hypertension is when it's between 120 and 139 for the systolic pressure, the top number, or between 80 and 89. And then stage 1 hypertension is between 140 and 159 for the top number, and 90 to 99 for the diastolic. Stage 2 is when the blood pressure is over 160 systolic and over 100 diastolic. So for most adults, the target blood pressure, even though it's borderline high, is 140 over 90. So that's usually the target that we treat for most adult individuals. When people have diabetes, they're considered to be at higher risk for diseases that involve the blood vessels. So that includes the back of the eye, the retina, the tiny capillaries that are in our kidneys, and just the overall circulation and for the heart itself. So having a blood pressure with diabetes, the goal is below 130 for the top number and below 80 for the lower number. And for some high-risk individuals with coronary artery disease, narrowing of the arteries, with angina, often we aim for 120. However, we have to tailor that to the individual, because if we're elderly, we don't want the blood pressure to be too low, where there's a risk of fainting and falling and having injuries. But for most people with higher risk, cardiac risk, then they usually aim for 120, if you can do that without risk or danger to the individual. So these are just guidelines, and they should be individualized based on your personal health history. So it's something that you would talk about with your doctor, either your specialist or your family doctor. So why does blood pressure matter? So it's not just a number. So because high pressures over time, just like too much pressure in your pipes could damage your plumbing. So high pressures in our blood vessels can cause damage to those blood vessels themselves. They can dilate and cause aneurysms, or they can tear apart or develop plaque that can narrow the arteries. And also the vital organs that are served by the blood vessels can be damaged by too high a pressure. So that can affect almost every part of the body. So high blood pressure chronically over time causes atherosclerosis, which is hardening or thickening of the walls of the arteries that supply blood to every organ of your body. And this can lead to problems with the circulation in the heart itself. So the blood vessels feeding the heart muscle If those are narrowed, damaged by high blood pressure, or other factors like cholesterol or smoking, can narrow the blood vessels feeding blood to the heart muscle itself, and that can cause chest pain, or what we call angina. It can affect narrowing of the arteries to the extremities, down your legs, down to your feet, and this can cause poor circulation or gangrene, and sometimes amputations of toes or feet in extreme cases over time. High blood pressure can damage organs like the kidneys and other essential organs and cause erectile dysfunction as well. And high blood pressure contributes to your risk for heart attacks. That's when there's a blockage of the artery that's supplying a part of the heart muscle. Angina is where the artery is narrowed in the process of narrowing of the arteries, atherosclerosis, and you can get chest pain or throat pain or arm pain with exercise or other times when the heart rate is high, like with anxiety or stress. Heart failure is when the heart muscle itself is fatigued and your heart can't pump as much blood, and the blood can back up into your lungs and cause shortness of breath when you're doing everyday activities or when you're lying down. And it can cause aneurysms, which is stretching and ballooning up of blood vessels, such as in the aorta in the chest or the abdomen, or even in the blood vessels in the brain. And in this way, high blood pressure can contribute to strokes, either through bleeding with a breakage of a blood vessel, or from narrowing of the arteries for the atherosclerosis or narrowing of the smaller arteries in the brain. It's a common cause for dementia. So decreased circulation in the brain because of damage to those blood vessels over time with high blood pressure can cause cognitive impairment and eventually dementia as well. And because the small blood vessels in the back of the retina can hemorrhage or be damaged, it's a common cause of vision loss as well. So sometimes an ophthalmologist might ask you to check with your doctor to check your blood pressure because they see some changes like bleeding or crossing changes between the arteries and veins in the back of your eye. So high blood pressure can affect your eyes. It can affect the brain and cause strokes or dementia. It can affect the heart, causing heart failure, angina, or heart attacks. It could be a cause for kidneys failing, and it can affect the circulation elsewhere in the body with narrowing of the arteries, potential gangrene in the extremities, or aneurysms in some of the blood vessels. So what causes high blood pressure? So the majority of people, 95% of people that are found to have high blood pressure have essential hypertension or primary hypertension, that there's no particular cause other than genetics and aging. So blood pressure tends to rise slowly as we get older. And if you have a family history of a mother, father, or a sibling with high blood pressure, you have a higher risk as well. Secondary hypertension can be caused by other conditions, such as kidney disease, pregnancy. There's conditions where blood pressure rises in pregnancy, especially close to delivery, called preeclampsia. If there's tumors in the adrenal gland that releases cortisol and norepinephrine, that can also raise blood pressure as well. And conditions of the thyroid gland that controls our energy level in the throat can contribute to high blood pressure and faster heart rates. And some medications, such as anti-inflammatories like ibuprofen or Advil that you get over the counter, or Aleve or naproxen that's over the counter, can contribute to high blood pressure, as can the birth control pill in some women. And as I mentioned, a common cause is genetics, so family history, and as we get older, blood pressure tends to rise as well. Smoking contributes to narrowing of the arteries and can contribute to high blood pressure as well. Excessive alcohol or regular drinking on a regular basis also raises the blood pressure. It stimulates the heart as well. And being physically inactive, even though exercise temporarily raises the heart rate and the blood pressure, a lack of exercise can cause your baseline blood pressure to be higher as well. And that's why physical activity like cardio exercise, brisk walking, jogging, swimming, pickleball, those activities have a way of reducing your overall blood pressure as well. So, are you at risk for high blood pressure? Well, it depends on your diet. Are you consuming too much fat or too much salt? Because that can contribute to high blood pressure. Are you physically inactive? Do you smoke? Or do you have more than 2 drinks in a day? That could put you at risk for high blood pressure. And if your weight is higher than you'd like it to be, that can contribute to high blood pressure, as can a family history of kidney problems, heart disease, or high blood pressure. And of course, we're all getting older, so our risk increases over time. So 1 in 5 adults does have high blood pressure. So I think we have about 80 people registered, so that gives a fair number that actually have blood pressure that could be high even if you don't know about it. And our lifetime risk for developing high blood pressure is actually 90%. So really, we are all at risk. So we'll talk about if you should be screened and how often you should be screened. So let's talk about that myth. If I feel good, it can't be high. Most people, as I mentioned, with blood pressure that's higher than 140/90 actually feel perfectly well. It's only when it's extremely high that you might get symptoms. Most people think people with high blood pressure are really stressed out people, like family doctors or like Donald Duck. But you could be totally relaxed, and if you have risk factors, you still may have high blood pressure, not really realize it. But of course, usually when we're really upset, our blood pressure does go up as well. So most adults, people over 18, should check their blood pressure. So the hypertension guidelines in Canada are at all appropriate clinical visits. But I've noticed that since the beginning of the pandemic, where a large number of visits are not in person, but on telephone or video, people are not being screened as much. So I usually look through the chart when I see an adult patient to see when did I last check their blood pressure. And a lot of them, we've been just in contact by phone or video, and they haven't been in the office for a few years. So I do ask them to check their blood pressure either with a reliable machine, or we'd be happy to see them and actually check it in the office as well. So the general guideline is if you're over 18, you probably should check your blood pressure sometime in a reliable way, at least once a year, because it can creep up on you if you haven't checked it in a few years, because of course it doesn't have any symptoms at the beginning. So we'll talk a little bit how to measure blood pressure. So you have a couple of choices and some tips on how to reduce false high and false low blood pressure readings. So this is the gold standard, the mercury sphygmomanometers. You won't see them too often. You won't see them in the hospital anymore, just because they're quite expensive. And also there's that risk if they fall down, they get broken, some of that mercury can spill out. But this is the gold standard because it gives the most reliable reading. These are the most common ones that you'll see in the hospitals as well. So it's the aneroid sphygmomanometers. That's our fancy term for the equipment we use for measuring blood pressure. And of course, we have to use a stethoscope along with it because I'll explain to you what we're doing when we're measuring blood pressure as well. So these are the most common ones you'll see in the hospitals and your doctor's office. And these are supposed to be calibrated for life. We do check it periodically against our gold standard in our office. And you may see these automated blood pressure machines. So there's many different kind of automated machines. There's common home machines. They come made by a variety of companies in different countries. They're not all reliable. So when patients have home blood pressure machines, if we're relying on those numbers and they have high blood pressure in the office, we often will get them to bring in the machine so that we can compare that their numbers are matching ours with their machine. So it could be equally high in the office, and we're relying on their home readings that are lower. We just have to be assured that their machine has been checked out at least every couple of years. But there's some professional machines like you'll see in the hospital that are calibrated regularly by the hospital staff. And they will usually read the blood pressure 3 times and take an average. So here's an example of a home blood pressure machine. So this is actually the more common one that I recommend for patients because I find that the LifeSource machines, this inexpensive $50 or $60 machine, gives very reliable readings that are very similar to what I get in the office when patients drop these off for me to check out. So as I mentioned, If you are relying on a home blood pressure machine, make sure that you check it out every couple of years. If it's more than 5 years old, then you may want to ask your doctor if you could drop it off and he or she can check it when they have time at the end of the day or on the weekend. It's actually quite time consuming to do it in the office during your visit. We can check the blood pressure pretty quickly in less than a couple of minutes, but the machines inflate very slowly. So it actually adds a lot of time to do it in the office. So often we might do a one-off initially with patients when we're checking, but periodically we ask them just to drop it off at the office so I can check them out when I have a bit more time on the weekend. So there's a website, the hypertension.ca or Hypertension Canada. They usually have an up-to-date list of models that they've checked out that they think are quite reliable. And as I mentioned again, regardless of machine that you buy, get it checked periodically with your doctor's office. So now that you know about equipment, let's talk about your position and your posture when you're measuring blood pressure. So you should be sitting, ideally for 15 minutes in one place when you're at home. You should be pretty relaxed. Your both feet on the floor and not crossed, because crossing your legs can actually raise your blood pressure. If you're contracting a muscle, that raises the blood pressure too. Your arm should be supported. So it should be roughly the middle of your upper arm should be around the level of your heart. Okay, it's like around the nipple area. So usually a tabletop or a desk is quite appropriate. When I measure in the office, I'm actually supporting the patient's arm with my arms, and I want their arm to relax, regardless how heavy their arms may be. So that gives a good, reliable blood pressure. Because if the arm is actually down and below the level of the heart, the blood pressure tends to be a little bit high. And of course, if a patient is lying down, then that's actually the appropriate level too, because the arm will be even with the heart level too. And you shouldn't be chewing gum, you shouldn't be talking at the same time, and you shouldn't be contracting any other muscles. So I try to politely tell my patients that we won't talk for a moment while I'm checking the blood pressure, because we'll probably get a false high reading. So technique is very important too. So what we're actually doing was we put on the cuff, make sure it's the appropriately sized cuff as well, and we actually pump it up well above what we think the blood pressure should be. And then we slowly deflate the blood pressure about 1 division that you see on the dial per second, or 2 millimeters of mercury per second. And at the same time, I'm actually listening with my stethoscope. So when I'm pumping the cuff above the level of the blood pressure, when I'm listening, I won't hear the pulse until the blood pressure matches the pressure that I'm deflating the cuff to. So if the person's pressure is 160/90, I'll start hearing that sound with my stethoscope when I see 160 on the dial as I'm slowly deflating. A lot of patients actually will look to the dial while I'm doing it. They won't be able to see anything that will give them any clue, even though it'll be kind of bouncing up and down with the needle. It's the listening that tells us where the blood pressure, the systolic blood pressure starts. And then when that sound of the pulse disappears, that's what we consider to be the diastolic blood pressure. So the resting blood pressure when the heart's relaxed between contractions. So it's quite ingenious how the early physicians discovered how this works in such a reliable technique. And then through studies, we've discovered what is healthy and normal and what is higher risk in blood pressure readings over the past 100 years. So let's talk a little bit about sources for error in our measurements. So the wrong cuff size, deflating it too fast, an irregular pulse like atrial fibrillation, not inflating it high enough and then missing the top number. If we're talking and holding our breath, or if we're tensing up our muscles, or if we're doing repeatedly on the arm, then the veins get congested and it tends to lower the blood pressure that is read by either the machine or with our stethoscope when we're lifting. And then a lot of people, blood pressure is high when they're in a clinical setting, like in the hospital or the doctor's office. So let's talk about the cuff size. So when you put on a blood pressure cuff, there are actually index lines that tell us if the cuff is too small or too large. So if you've got a skinny arm and the cuff is too big for you, then the numbers are going to be incorrectly low numbers. They won't reflect what your true blood pressure is. And likewise, if you've got a really big muscular arm from working out and we're using a smaller standard size cuff, it's going to make the numbers higher than the true blood pressure. So that's why cuff size is so important. And that's why a really big man that's checking his blood pressure in the drugstore that has a medium-sized cuff, they're going to get higher numbers than might actually be what their blood pressure is. And if someone is really thin and lean, a standard cuff might falsely give you reassurance that the blood pressure is lower than it truly is. So make sure the cuff fits. And usually you can tell by the index lines on the cuff itself. And if we're deflating too fast, then we might miss out on the top number because we're listening very carefully as it's coming down, and we're deflating too fast, like much faster than 2 millimeters per second. We're going to underestimate the top number. And some people have an irregular heart rate where there's some pauses in between. And in this case, we have to deflate the cuff more slowly and repeat the measurements because sometimes we'll miss the top number or miss the bottom number. So most standard blood pressure machines aren't able to do it, but some more expensive machines can adapt to an irregular pulse like atrial fibrillation. And in some people, we have something called an auscultatory gap. So instead of listening, hearing that pulse when we reach the top number, it should continuously be hearing the pulse until it disappears. And then that's the lower number diastolic pressure. So in a lot of individuals, they have an auscultatory gap. So you have the systolic pressure, we'll hear the pulse when we're listening, and then we'll hear a pause for about 10 or 15 millimeters mercury, and then we might hear the pulse again. So that's why we always deflate all the way down almost to zero so we can see if there's actually a gap, because that gap can cause errors. So someone has a gap like that there's a gap in their blood pressure where we don't hear a pulse between, for example, 110 and 120, and we didn't pop up above the 120, we might think their top blood pressure is 110 rather than being above 120. So we have to pump it high enough, listen carefully, listen for any gap, and deflate all the way so that we don't miss any of the numbers. So sometimes if you have a machine and you have that kind of gap, if the machine doesn't inflate high enough, so if your true blood pressure is 180 and your cuff is only inflating to 160, it might be catching during that auscultatory gap and then only pick up a lower blood pressure when it picks up the pulse. And as I mentioned, talking, chewing gum, holding your breath, tensing your muscles, all those things raise your blood pressure temporarily. That doesn't mean that if you have high blood pressure, you have to stop chewing gum, talking, or holding your breath. It just means at the time we're measuring, you should avoid doing those things because it'll be higher than the resting blood pressure should be. And as I mentioned, venous congestion, and we're repeatedly, like 3 or 4 times, measuring our blood pressure. The numbers will tend to go down if the arm is getting really congested in the veins. So it's actually better to take off the cuff, wait a minute, and then put the cuff back on and then inflate it. That's really more realistic. So I sometimes want to make sure the patients aren't fooling themselves by just picking the best numbers that they're going to share with me, just to avoid taking medication or minimizing medication. So you really want your home blood pressures to reflect the true blood pressure and not to give lower numbers than they truly are. Because the whole goal is to prevent disease in the future due to high blood pressure. And of course, white coat syndrome is when your blood pressure is significantly higher, like 10 or 15 millimeters mercury higher when measured by the healthcare provider. On average, most people are about 5 millimeters mercury higher when they check at a doctor's office than at home. So a very small amount of white coat effect. But some people, it's a huge difference that they'll get 160, 180 when they're in the hospital, but at home, they get a nice 120, 130 number. So we usually confirm this by getting the patient to do home blood pressure readings. And I also ask people to check at work during their breaks. Because if you're at work 8 hours of the day, your average blood pressure is an important factor to consider. So I did have one patient where we did a 24-hour blood pressure monitor. It's a monitor that they got to wear for a whole 24 hours. We have to pay extra to get that done. to some of the special clinics. And then they'll go every hour, it actually starts inflating by itself, no matter what the person's doing, even when they're sleeping. And usually pressure during the night is going to be a little bit lower. And then they'll give us a readout from the program, and they'll tell us when it's actually high. So I had one patient that I coined the term white collar syndrome, because he was an accountant and the blood pressure was only high when he was actually at work, and it was fine in the office and fine when he was at home. So it's been better since he's retired. So what can we do to prevent high blood pressure, and what can we do with our lifestyle to manage your blood pressure? So it includes physical activity, weight reduction if it's needed, moderate or reducing your alcohol intake, eating healthier, reducing salt in your diet, and reducing stress. And of course, if you do smoke, stopping smoking as well. So for physical activity, the Canadian guidelines are 30 to 60 minutes of moderate physical activity, like a brisk walk or cycling or swimming, or playing pickleball. So 4 to 7 days a week. So this, on average, not in everyone, but on average in the population, may bring blood pressure down by almost 5 millimeters for the top number and almost 4 millimeters for the lower number. So we want to maintain that healthy weight range, not too low and not too high, because this has a correlation as well with blood pressure. And sometimes just lowering our body mass index if it's a little bit too high, or reducing our waist circumference or abdominal fat may reduce your blood pressure by, on average, by 7 millimeters of mercury for the top number and 6 millimeters for the diastolic for every 4.5 kilogram weight loss. And then moderate alcohol intake. So this has changed the alcohol guidelines for Canada. So in terms of blood pressure, we should limit alcohol to 0 to 2 drinks per day. For men, less than 14 drinks per week, and for women, under 9 drinks per week. And by drinks, we mean depending on the percentage of alcohol. So cider beer is on average 5% alcohol. So that's equivalent to 1 can or 1 bottle of beer, 341 mils. And another standard drink would be a standard small glass of wine, 150 mils, because wine is 12% alcohol content. And then just 1 shot or 1.5 ounces or 45 mils of spirits like gin or vodka, because those are 40% alcohol. So a standard drink depends on the concentration of alcohol. So that gives you some guidelines. So limiting it to 0 to 2 drinks a day might reduce blood pressure by 4 millimeters on average. But I've seen more dramatic improvements in a lot of my patients that are drinking 3 or 4 glasses of wine a day, and then they cut it down to, gradually cutting it down to 0. But it's really important to know that we don't actually recommend having 2 drinks a day or 14 drinks a week if you're a guy, and 9 drinks a week if you're a woman. The Canadian guidelines for healthy drinking or low-risk drinking is 2 or fewer drinks per week, because there's other risks besides the blood pressure and other risks besides the effect on your liver with alcohol. So it's important to know that alcohol has other toxic effects. Of course, it's psychoactive. We can get dependent upon it. We can be addicted to it as well. But it's also a carcinogen, a group 1 carcinogen. This is the highest risk group, as bad as asbestos for causing lung cancer, or radiation, or smoking cigarettes. So these are high-risk carcinogens that can cause cancer. Alcohol can also damage the heart muscle more directly, causing what we call cardiomyopathy, and it can contribute to heart failure as well. And of course, it contributes to high blood pressure, and excessive drinking can cause damage to the brain, what we call alcoholic encephalopathy. And it causes a variety of cancers, including cancer of the larynx, anywhere in the mouth, in the throat, throughout the digestive tract, the liver. It can cause increase in breast cancer, and of course, the esophagus as well. We can also eat healthier. So the DASH diet, or the DASH-like diet, is a diet that's high in fresh fruit, vegetables, and fiber. high in non-animal proteins such as soy, vegetable sources, and low in dairy fat, and less than 2,000 milligrams of sodium or salt per day. So this type of diet tends to lower blood pressure on average by 11 millimeters of mercury for the systolic pressure. And by reducing sodium to under 2,000 milligrams a day, which is just half a teaspoon of salt, which contains 1150 milligrams of sodium. So reducing sodium to under this amount can drop blood pressure on average by about 5 millimeters systolic if you reduce it down to 1,700 milligrams per day. So the way we can do that is to limit processed food like sandwich meats and takeout foods and frozen foods. Be cautious about salt and seasoning we use, including MSG, when we're cooking and preparing food. We want to emphasize more vegetables and fruits and low-fat milk products, whole grains, lean meats, fish, more legumes and nuts. And you could also read labels to look at the sodium content. Reducing stress can also lower the blood pressure as well. So we could do that with cognitive behavioral therapy, looking at what thoughts make us feel more stressed, to reduce our catastrophizing or thinking about the worst case scenario, to focus on the positive in our situation, to not take things so personally when they're not intended as personal. Any form of meditation is useful for raising serotonin and helping us to relax and can contribute to a drop in blood pressure. This was shown in the 70s and 80s by Herbert Benson at Harvard with the relaxation response, which is part of meditation and yoga. Anxiety Canada now has a MindShift app that has lots of breathing exercises and other ways that we can reduce our stress levels and anxiety levels. So on average, this can lower blood pressure by 6 millimeters of mercury, but maybe more so in people that are really stressed. And of course, stopping smoking will help lower your overall cardiovascular risk and lower your blood pressure and heart rate, because nicotine, like caffeine, can raise the heart rate and the blood pressure. And a lot of people are getting addicted to nicotine gum. So 4 milligrams of the nicotine gum is like a cigarette, and that can raise the blood pressure by 12 millimeters of mercury. And of course, there's medication. So we can't manage it by reducing sodium, doing moderate physical activity, quitting smoking, limiting alcohol, doing meditation and mindfulness, staying out of white collar situations that raise your blood pressure, and staying out of the doctor's office when you can. Sometimes we do need to use blood pressure to keep the blood pressure in a safe range. So your doctor may prescribe medication if your blood pressure is not controlled by the healthier lifestyle measures. And it's really important that you understand why a blood pressure medication or any medication is prescribed to you. So for any drug we prescribe or recommend, it's really important that we explain to you and that you understand the common side effects from the medication and also the more serious side effects, as well as any interactions with food or other medications you may be taking. So that's really essential that you know that about any medication. So I often with the handouts that I give to patients, I ask them, or to people in our audience for Empowering Patients, I ask them to print it out and share it with their doctor just to make sure all your answers are all your questions are answered. These are just 5 of the most common classes of medications that we use for high blood pressure. So I can just go through their common side effects so that you can roughly understand what side effects you might anticipate or watch out for, kind of like the pros and cons of each medication. So first, the diuretics. Patients often refer to these as water pills because they can make you urinate a little bit more. Examples are furosemide or hydrochlorothiazide or diazide. So these, of course, increase urination. They can affect your kidney function, and they could lower your level of potassium, an essential electrolyte in your blood. So if patients are taking these medications, we periodically, at least once a year, like to check their kidney function with a blood test. And we also just make sure that they're sodium or potassium is not at a low level. So we do like to check that periodically with blood tests if you're taking a diuretic. Another class are the beta blockers. So they work to slow down the contractions of the heart. So they slow down the heart rate. Examples are propranolol or bisoprolol or tenormin. They can also make you feel tired, and they lower your heart rate, so you might feel more fatigued or tired when you're trying to do some cardio exercise like walking. In some people, they can make you feel a bit depressed, and they can cause erectile dysfunction in men. And in some asthmatics, it can actually worsen their asthma. So we usually do a screen to make sure we're cautiously prescribing us or using the right kind of beta blocker in people that have asthma or chronic lung disease. Another class are the calcium channel blockers. Nothing to do with the calcium that you might consume for your bones. So examples are Adalat or nifedipine, Norvasc, or amlodipine. So these are very safe for the kidney and the liver, but their common side effects at higher doses are constipation and some swelling or edema of the feet or legs. So usually low doses are well tolerated, but higher doses of these medications can cause that bit of edema or swelling. That edema is more of a nuisance. It actually is not due to any harm to your kidneys or to your heart, but it's a common side effect of a calcium channel blocker. And then ACE inhibitors are commonly prescribed drugs like ramipril or quinapril. So in a number of patients, not the majority, but maybe 10 or 15%, they may cause a dry cough. And it's not any damage to the lungs, it's almost like a little reflex. And usually that shows up within a couple of weeks of starting an ACE inhibitor. They also might affect kidney function or raise your potassium levels rather than lowering it. They can make them higher. So when we start an ACE inhibitor, or we raise the dose, standard practice is to check the kidney function and the potassium levels within approximately 7 to 14 days afterwards when we make a dose change or when we start it. If you get the dry cough, though, even if you continue it, you'll continue to get the dry cough. So for that reason, we usually have to switch to a different medication for people because the cough is quite irritating. It can keep you awake, it can keep your family members awake, and it is a bit of a nuisance. It's not an allergic reaction, but it's just a kind of a reflex reaction that some people get. So most don't get it, some people will. So we always ask patients to watch out if they get an irritating cough. An alternative to those ACE inhibitors that cause the cough are similar drugs called ARBs, angiotensin receptor blockers. So they work in almost the same way, but they don't cause the cough. Examples are losartan or valsartan or irbesartan. They also can affect the kidney function and raise the potassium levels. So like these, if we start them, usually within a week to 2 weeks of raising the dose or starting it, we do a blood test to check on kidney and potassium levels. Of course, any medication, even natural herbal medication, has a potential for an allergic reaction. And any blood pressure medication, because its intent is to lower the blood pressure, may cause hypotension or too low a blood pressure. And if your blood pressure is too low, the symptoms are feeling really fatigued, feeling lightheaded and faint, especially when you're standing up from lying down or when you're standing up from sitting. So, in particularly vulnerable patients like the elderly, we usually start at a really, really low dose and just gradually increase it to get control of the blood pressure at a safe level, trying to avoid the side effects of too low a blood pressure or hypotension. Because sometimes the risk for hypotension is greater for someone that could be badly injured by a fall at home. So if you stop the blood pressure medication without checking with your doctor, it could result in a rebound increase in your blood pressure. So if you do have high blood pressure, work with your healthcare provider to find the best combination of your healthy lifestyle habits and medication if it's necessary and appropriate. So just remember, every one of us has a positive potential, and I believe that we each have a unique potential in life, and it's our duty to realize our individual potentials and more importantly, to help others achieve theirs. And together, we can achieve our positive potential. With knowledge, engagement, and support, we can manage chronic health conditions and live well. And I want to remind you that every one of us here has a common chronic condition. I have it too. It is incurable. It is sexually transmitted, and it has 100% mortality. Yeah, you guessed it. That chronic condition is life. And we're here to make the most out of it. And this is just a plug to remember to share what inspired you, what you learned today with people that you care about, with your neighbors and your friends, and to invite you to walk with your dog. This is from last year's walk. It's a great turnout, and we're expecting an even greater turnout with even greater weather on May 17th. So I'm looking forward to seeing you all in person, May 17th. And remember, we're here because we're part of a greater community, and we're all expanding our circle of care. And so please share our talks and information you've learned with your friends and neighbors and your loved ones, because we're all here to care for one another and to care for ourselves. And think of your healthcare providers are here to support you as well. So that's the website for the Burnaby Division of Family Practice and my own personal blog. I've been writing for the Burnaby Now since 1991, and sadly, the Burnaby Now and the New Westminster Record are actually closing business, so their websites are going down. So that's kind of sad, writing for the paper for so long. Initially, it was like every week in the print newspaper, then eventually it was once a month. And then we went online when Burnaby Now and Tri-Cities went online only. So, but you can read all of my old articles and ongoing articles and new things that I'll post on my website on davidicuswong.wordpress.com. So thank you for your kind attention. I'm going to stop my share, and Leona will let me know if there's any questions. So if you have any questions about the content about high blood pressure, be happy to answer
Excellent.
them.
That was so good. Thank you so much for that reminder. A lot of those things resonated with me, so thank you for that. So the question here is, pardon me if you mentioned it, is there a certain age where most people in Canada become predisposed to high blood pressure or should check into it?
Any adult, so probably everyone in the room. As I mentioned, 18 or over, you probably should check your blood pressure about once a year. Yeah, and the older we get, it tends to go up a bit higher. And if you have other risk factors like diabetes, if you're physically inactive, if you have a family history of heart disease. So most people, if they know that their mother or father had a cardiac event or a stroke, we know that the usual risk factors will be high blood pressure or smoking or cholesterol or diabetes. So these are all these things that we screen, the metabolic screening, like we were talking about with that shared care program, and the screening things that we should be checking on a regular basis. So definitely you're at higher risk the older you get. And so when we reach middle age in the 30s and 40s, we should start checking it regularly. And the older we get, even if you're feeling great, we should check our blood pressure. And sometimes our brains get used to blood pressure that's 160 over 90. And then when we bring that blood pressure to normal, you might feel a bit more tired at the beginning or more lightheaded. So it takes a bit of adjusting. And that's something we have to really partner with our patients carefully, because they might feel worse when we're treating the blood pressure. And that's why we go pretty slow and carefully, so that the patient actually feels better and understands why we're keeping the blood pressure safe.
Yeah, that's great. Thank you. Somebody, and speaking of that shared care project about metabolic testing, so I've put the link again in the chat, just as a reminder that we do have these upcoming pop-up clinics available. So if you're not attached to a doctor, you don't have access to those types of screening, make sure you check out that website, because we'll be updating it regularly. So a question here, does coffee affect blood pressure greatly?
In some people, like some of my patients will come in to check their blood pressure, and then they would have skipped their cup of coffee. But we think, yeah, it could temporarily if you're really sensitive to caffeine, but we think it's safe to drink up to 3 cups of coffee unless your blood pressure is really unstable. But it's not the primary cause for high blood pressure.
Great. Okay. If lifestyle changes reduce your blood pressure, does that mean you no longer have high blood pressure?
That's true. So unlike diabetes, once you have diabetes, we always say you have diabetes, but we can metabolically reverse things. So I would have predicted just from genetics from my parents that I would have needed to take blood pressure medications a while ago, like by the time I turned 40. But I do a crazy amount of exercise and my blood pressure is low, like 110/70. So if you know your family history and you should still monitor and get checked and monitor those things, those risk factors. But you could do, amazing things with lifestyle. And I bet most of you wouldn't be willing to swim 80 lengths 7 days a week, twice a day.
I don't. I can't even. I can't even, Dr. Wong. I know how much exercise you do. It's crazy. Anyways, does anyone else have any questions? We do have time. It's just after 8. Here we go. How often does your blood pressure need to be high before damage is done, or is damage done?
Well, it's the blood pressure on average over time. So if you just check it 3 times in your life, we don't know what it's like in between those measurements. So we really so that's why home blood pressure machines that are accurate are so useful. If people have a high blood pressure in the office, then we do want to make sure that they're checking it regularly, that we're checking to make sure we have an accurate machine. So it's actually over time. So if it's moderate hypertension, like 140, like the worst thing I could do is ignore someone that comes in with a blood pressure that's just borderline 5 years ago, 140/90, and not see them for 5 years and follow up with their blood pressure or asking them to check it. Because they could come in 5 years later and it's 160. And it's over the span of time of years that their blood vessels and their organs are being subject to that higher pressure. So it's the degree of the type, if it's stage 1, 2, or 2 hypertension, and the duration, how long it's been going on. So usually years, unless it's extremely high blood pressure, like over 200 systolic, over 100 diastolic, that can cause short-term damage like strokes or heart failure.
Okay, great. Thank you. Can the dosage of the high blood pressure medicine be split up, half in the morning and half at night?
We often do that, but then some patients have like a big pill burden if they have to take it twice a day. So you have to tailor it to the individual, but it also depends on the blood pressure pills because most of the blood pressure pills work for 24 hours.
Okay.
And sometimes we'll vary the time or split the dose if they have an unusual diurnal variation in their blood pressure. Because most of the time the blood pressure is lower during the night and then early in the morning it starts peaking up. That's why a
Right.
lot of heart attacks tend to happen early
Oh,
in the
really?
morning. Yeah, yeah,
Oh,
strokes and
wow.
attacks tend to be early in the morning.
Interesting. Okay.
And
Thank you.
it's not just because you have to go to work.
Depends on the day. Depends on the day. Are there similar risks for low blood pressure?
Low blood pressure mainly is a problem with fainting or passing out or having falls. So blood pressure in a young woman, like girls in their teens, like we see a girl elementary school or high school, maybe every couple of weeks who has fainted in class. And it's usually because their blood pressure is a bit low, not so much for anemia or other things, but it's because their blood pressure baseline is low. If they're standing a long time or get up too quickly, or they get a surprise or a shock or sudden pain, then it can drop out and then they can start feeling lightheaded and woozy. So the symptoms of acute hypotension, it's important for people to know this, would be feeling a bit lightheaded, feel like you're about to pass off, feeling kind of sweaty and nauseous. People are looking at you, they say, you look kind of pale or gray. It's really important you don't try to stay standing up, but you sit down and put your feet up. So if you see
Okay.
someone that looks like they're about to pass out, don't hold them up, but gently bring them down and help put their feet up and make sure that they're okay.
Okay, great. That actually happened to a friend of mine last summer. So, and I think that's what it was. So, okay. Let me see. How high a blood pressure would cause heart attack or stroke?
So it would be a blood pressure over 140/90 over a number of years.
Over a number. Okay. Great. Any alternative medicine like herbal medicine proven to be effective?
Can't think of any that are as effective as just the lifestyle changes
Hmm.
or the medications as well.
Okay, that's fair. Does blood pressure raise and fall greatly over the day? Sometimes I check and get concerned, 160, and then other times it's not too bad, 140.
Those are a little bit on the high side. So you
Both
may
of them are.
want, yeah, you may want to check more regularly, but make sure it's ideal conditions, like not when you're stressed or in a conversation, because all the studies are based on resting blood pressure when you're sitting, arm at the heart level, not talking, not stressed, not in any pain at that time. So all the studies are based on that resting blood pressure. And it's usually the average blood pressure for the whole day that we're concerned about.
Okay, great. All right, anybody else have any questions? Looks like people want to start their long weekend, which is, there's
Yeah,
nothing, absolutely nothing wrong with that.
yeah. So enjoy your long weekend. Thanks for joining on this like a Friday before a long weekend. It looks
It
like it'd be
is.
great weather for a walk. And I'm sure we'll have great weather on Saturday, May 17th. So I'd like to see
May 17th.
every one of you in person. I see a lot of my
That's great.
patients are here. So I want to see a lot of my patients at our walk as well.
Yes, I'd
And
love to
yeah,
see you guys in person. It'd be
yeah.
great.
And my talk at Confederation Senior Center, which
Yes.
is just by the park too, just before.
Exactly. Yeah. Out at in the 10 o'clock. You're on at 10 o'clock.
Yeah, and if
Someone said
if people register early, then they're more likely to get the swag, right?
swag.
Yeah,
Yes. Please
yeah.
be sure to register with the link I shared in the chat. Then you be almost guaranteed to get a little something, a little gift. Somebody said I've been taking blood pressure medication for the past 1 month, but anytime I check still high, what should I do? Oh, anytime that they check, it's still high.
Well, if you're not checking at home, I would suggest a good home blood pressure machine, like one of those
Right.
that your healthcare provider also has checked, just to make sure it's not white coat syndrome.
Right.
And it could be because there's just so many different blood pressure pills. Some people need to be on several at one time. So some people 3 or 4 to get to goal. And it's not a failure of lifestyle. Often it is genetic. So I don't want to give. So I might be on blood pressure pills in 20 years. So it's not due to a failure or bad behavior. A lot of it has to do with genetics, a little bit with aging, and other factors too. But of course, if someone has really resistant blood pressure, then we should look for those secondary causes. So like majority is essential hypertension. There's no particular cause except for genetics and aging. But some people it could be due to kidney disease, or it could be other things like the thyroid or adrenal disease that could be contributing.
Great. Excellent. Oh, another one popped in. Are there physical symptoms for high blood pressure, like low blood pressure, example, tingling of extremities?
No, not unless it's extremely high, like the close to 200/100. That's where people might start getting neurological symptoms or changes in their vision when it's too high. So unfortunately, high blood pressure that can cause damage over time usually doesn't cause any symptoms unless it's extremely high or extremely low.
Okay. Great. All right. Well, I think we covered it. And I just want to take a moment to thank Dr. Wong just for another great season. I think this is our 10th season of doing these talks together. And I find it very meaningful in my life. And I know my parents check in every once in a while. So I'm really grateful to be involved in this program. And I look forward to seeing what our 25-26 season is going to look like. So okay. I think we've covered everything.
I'll get back to Tammy about your question about vision.
Okay, vision issues. Okay, there we go. Thank you so much. All right. Well, everybody have a great Easter weekend. Hope to see you in May on the 15th for BC Family Doctor Day and May 17th for Walk with Your Doc. As we've done every time, when I close the session, there will be an evaluation that pops up. If you could take a moment to answer just a few questions. There's 9 this time, 9 questions. It's really helpful for Dr. Wong and I as we plan into the next season. So thank you, everyone. Have a great Easter. Happy Easter. And hopefully we see you soon.
Yeah, happy Easter. Thanks, Leona. And thanks
Thank
everyone for
you.
joining us tonight.
Thanks. Bye.
Bye.